What's up, Danny Loves? It's your girl, Danny Marie, coming to you with the healthcare video that I promised you. At the end of my last video, I asked you guys to let me know some things that you wanted to talk about. And I know that a lot of you guys have a lot of questions about the stuff that's going on in our world right now. Um, that is probably going to take a little bit longer to talk about. So I'm going to start with the other requests that I received, and we will dip into the coronavirus, the COVID-19 pandemic that we are seeing right now, and everything that has happened in our country in preparation for or in an effort to prevent what's coming. So we'll do that at the end of the video. I'm going to start off with these other ones. And I know that I'm probably going to say some things that may leave questions in your mind. So please comment down below what your questions are. I definitely already anticipate doing a follow-up video to this one to answer any questions that are left after I talk about, what you've already asked me. So the first question that I was asked, I don't know what this is on my shirt, y'all. Oh, well. Anyway, first question that was asked was about Black women in the healthcare system. So yes, I am a registered nurse. However, I'm a Black woman first. So if you hear me say we throughout this topic, that is why. You cannot separate the different facets of who I am. I am a Black woman, so I understand where this question comes from. It is a very real thing that Black women are often not listened to in the healthcare environment. Um, it it can stem from, I think a lot of it stems from stereotypes. We are often not believed, not thought to know what we're talking about, not thought to be able to understand anything. And it's documented that you can look up articles. I'll post some of just different cases where women have not been listened to, and it has often been to our detriment, oftentimes to death. And it's a complicated topic. Actually, very difficult to try to get past it, because you have people get into healthcare when you decide to become a nurse, you decide to become a doctor, you get into healthcare to help people. You don't anticipate having any biases that are going to change how you care for people. If you ask any nurse, any doctor, if they treat certain patients different, their answer is going to be no, absolutely not. They can never fathom that they do it. But it happens sometimes. And I say that because it's the truth. There are, especially when it comes to maternity. With maternity, it's actually a little bit worse, with how things go as far as communication. Um, but I think that it's something that is going to take time to adjust. Um, as far as what Black women can do, what Black people can do in the healthcare environment to try to mitigate some of these issues. Number one, and what I was starting to say before, but I, came off of it. Let me go back to it. A lot of this comes from, the stereotype of the angry Black woman, or, Black people being hostile. And so for starters, we are very passionate people. We are fiery. We talk with passion. Sometimes we get, loud and boisterous, but that is who we are. We're like that when we're fun. We're like that when we're angry. It just happens. And so one thing that I think we can do to better advocate for ourselves is try to reel that in. We are severely underrepresented in the field of healthcare provision. There are not enough Black doctors. There are not enough Black nurses. There's just not enough of us. Black respiratory therapists, et cetera, et cetera. The list goes on. And because of that, you don't have enough people in the field who look like you, who understand how you talk to people, who understand how you carry yourself, to understand that when you're saying something, when you're questioning something, it could just be a question and you're not, trying to overstep. So I think the first thing that we can do to advocate for ourselves, which is what the question was, how do we advocate for ourselves with healthcare providers? I think we have to tone down some of our passion. And I know that's very difficult, but we have to meet healthcare providers where they are, um, and recognize that the vast majority of them, despite the history of, what healthcare has been like, and, the whole syphilis experiment, told it was vaccines, I believe it was, or something to that nature. That entire phase of Black people, dealing with healthcare providers, we don't have that anymore. That time in our history was a time where we were still seen as less than. And so, yes, people were experimenting on the Black body for different things. It was terrible. It was inexcusable. But healthcare now is not that. So go into your healthcare provider's office with an open mind, whether it's the ER, a doctor's office, an outpatient clinic, urgent care, whatever it is. Go there with an open mind. The reason that you're going is because something is wrong with you, and you have not studied medicine to know what that thing is. So go there with an open mind, but go there, having done some research, but recognize that your research is not what they've done in school. It's hard to help somebody who thinks they know everything. And so a lot of times, this is really bothering me, y'all. A lot of times we as healthcare providers can be taking care of somebody, and, we can run all the tests and figure out what the problem is. But before we can even, fully assess them to decide what tests to run, et cetera, they come in the door telling us that they know what's wrong with them. Now, if you have been to, say, 5 different doctors and, nobody is able to figure out what's going on with you, I fully understand you coming into an office and saying, look, I've been tested for this, I've been tested for this, I've been tested for this, and all these things came back negative. I'm still having XYZ symptoms. I need help. That is a 100% valid statement to make, and that is something you should be saying, because you would help us know which tests we don't need to do, or at least, which tests could have been, negative before, but as the disease process worsens, they might come back positive, etc. So if you come in and you tell us that you've been tested for XYZ, that's a start, and that helps. But if you haven't seen anybody and you don't know anything about what's going on with you, and you come in trying to tell us, you think that you have the worst of the worst condition, is it possible? Yes. But is it likely? Depending on your symptoms, probably not. And a lot of times people will come into the ER. Anytime somebody comes into the ER, and I say that because I'm in the ER, people always think that they're dying, when we have actual people in the ER who are dying. So it's all about how you carry yourself. It'll help you out a lot. You have people that come in, screaming and cussing. Are you hurting? Absolutely. Is that necessary? More than likely it's not. And that doesn't get you back any faster. That doesn't make your tests come back faster. There are processes and protocols that have to be followed no matter what. Certain tests take a certain amount of time, and it doesn't matter, how much you're screaming and crying. We can't speed up the process of that result. So when you come into a healthcare provider's office, come in with an open mind. Have an idea of what your symptoms are so that you can be able to help us figure this out. If you have questions, ask them. You have the right to ask any question you have about your care. Nothing that is being done to you, nothing being done for you should be done without you knowing it. So please ask questions, but ask them respectfully. Don't ask them in a condescending way as if you're assuming your healthcare provider doesn't know what they're doing, because that creates, that mistrust in that relationship, and that does not help us be treated well. I will say that while that will help the situation, if you can be calm, cool, and collected, if you can ask questions, get answers, and even if you have a healthcare provider, because sometimes As a healthcare provider, I can say this, I've seen it happen a lot. People will forget that you don't understand medical terminology. And so they might be speaking to you and they think they're speaking clearly, but it's walking all over your head. It is totally okay with you to interject and say, hey, I don't know what that means. Can you break that down for me again? Because we want to help you. So please ask questions, but just be respectful. And that will be the biggest thing that you can do to help your care. It is also 100% okay if you don't feel comfortable asking questions to your doctor, to ask them to your nurse. That's what we are there for. We are there to be an extra person in between you and the doctor to help you get the care that you need. When you are hurting, you tell us so we can get you pain meds. When you're, hungry and thirsty, you tell us so we can get you a snack. So if you have a question about what's going on in your care, please ask us. If we can't answer what the plan is for you, what the test results look like, what the test results mean, although we should be able to for the most part, if we can't, we can go get the doctor, bring them in. The two of us can sit there together and try to explain things to you. So please make sure that you're asking questions and that you're getting answers that you understand. Don't say you understand something if you don't, because then you leave the office and you're still in the dark about what's going on with your care. So that's my first point about how we can advocate for ourselves with the healthcare provider. My next question was doula versus OBGYN. So I can't talk about doula versus OBGYN without talking about midwives. So an OBGYN is a medical provider. They are a doctor. They have gone to medical school. They have studied women's health, and they can do everything from gynecological services, that's the GYN and OBGYN. Gynecological services, doing your regular pap smears, your regular, GYN standard women's appointments, doing the self test where you check for any tumors in your breast, but it's not self because they're doing it, but they can assess your breast for any tumors or any reasons for you to need to go and get your mammogram, even if it's early in age, etc. So yeah, they can do all that type of stuff. That is what an OBGYN does on the GYN side. And then on the OB side, they do all things related to maternity, pre-pregnancy planning and care, pregnancy planning and care, delivering of the baby, and then postpartum care. That is what your OB does. You can be a GYN and not be an OB. You cannot be an obstetrician without being a gynecological doctor. So that is that. Now, a doula. A doula is a person who is there to navigate the birthing process for the mother. That is the purpose of a doula. Definition that I looked up says doulas focus on the needs of the mother, offering mental, physical, and emotional support. Doulas do not have to be certified in any kind of way. A certified midwife, on the other hand, have medical training, and during the birth process, they focus on delivering a healthy baby. That being said, I know that we are now in an area where, especially with going back to the Black women in healthcare thing, there is a high maternal fatality rate for Black women, and a lot of Black women are thinking about, birthing children outside of hospitals, be it home birth, birthing center, etc. If you decide to go one of those routes, you should have a certified midwife who is also a doula. There are people who have both certifications, and that is full encompassing care. If they have both certifications, they know how to care for you as the mother, as well as how to care for that unborn child who will become the born child, and make sure that that delivery goes well. Me personally, I think that doulas and midwives are fantastic. I have toyed back and forth with whether, when the day comes that I decide to, be married and have a child, that I would like to maybe do a home birth or go to a birthing center. But I also am aware of how often babies have complications when they are born outside of a hospital. And I say that not meaning it's due to an error on the care provider's part, but using, broad numbers that are not factual at all. Say 99% of babies that are born are totally healthy, right? And 1% have some kind of an issue. If that 1% is born in a hospital, they are more than likely going to make it. But if you happen to deliver one of those 1% babies at home, there is a lesser chance that they'll, be able to recover. Something about pediatrics that all peds nurses and doctors will say, peds will compensate, which means that they will adjust in a way when they are ill, and they will continue to adjust and adjust until they can't adjust anymore. So the way that we say it is that pediatrics, they compensate until they can't. So if something is going wrong, say they're not breathing well, they will, figure out ways to get air until they can't do it anymore. And now they're blue, et cetera, et cetera. And that can happen anywhere. That can happen no matter where the child is born. But if the child is born in a hospital and they turn blue, you have all the equipment on hand to deal with that situation, and the outlook is better. Versus if you do it at home and God forbid something happens to your child, you are X amount of minutes, miles, traffic dependent from the place that can save your child. So a lot of hospitals are starting to have more relaxed policies around labor and delivery. So if you can have your child at a hospital where you're allowed to bring in a midwife or doula, or they have a midwife or doula in that hospital system that, can take your pregnancy journey with you, and then be there for your delivery, that's ideal. And yeah, that's pretty much it. I think midwives and doulas do a fantastic service, and I fully support what they do, and I understand people who want to use them. I would just say try to use them in conjunction with the hospital system that your OBGYN is with. Hopefully that hospital system will have a doula midwife that can work with your provider, and you have a maternal medicine team that works together. That would be fantastic. So that's my opinion / actual definitions on the difference between a doula, a midwife, and an OBGYN. And so do with that information what you will. The next topic I was asked to talk about is myths in healthcare. I wasn't given too many examples of this, so this one's going to be a little bit difficult for me to talk about. I don't really know of too many myths in healthcare off the top of my head, but I can talk about, misconceptions, not necessarily myths, but just things that a lot of people don't know about healthcare that healthcare providers like us wish they understood. And oftentimes when we try to explain certain things to people do not listen. So one of the things that I can say I want to talk to you guys about is IVs. IVs, blood draws, anything that involves getting a needle into your skin. Often people say that they are a hard stick. It is very possible for you to be a hard stick, but we as healthcare providers often have certain rules that we have to follow. So I'll start off with, there are different sizes of needles that can be used to do a blood draw or an IV. And a lot of people will say, oh, I'm a tough stick, you got to use a butterfly. Okay, butterflies are a needle like any other needle. Yes, they tend to be smaller, but we have small IVs too. And you cannot use a butterfly for an IV. So if you are in the hospital and they need to get an IV, you can't say, go get a butterfly. It's not the same thing. It doesn't work. An IV, and I should have had one to show you guys. An IV is a needle, but around that needle is something that's like a little plastic straw. And so I'm gonna do it this way. So this is the tip of the needle. This is the tip of the needle. And then the straw is around it like this. So only the edge of the needle is out and the rest is the straw. We use the tip of this needle to go into your skin, and this is what gets the catheter into your vein. So once we have this in your vein, we pull the needle out and leave the catheter. And that is how we are able to give you meds, how we are able to draw your blood, etc. A butterfly does not have that straw around it. It is just the needle, and that is only for the purpose of drawing blood. So if you're in the hospital, they want to give you an IV, you can't say, go get me a butterfly. They are not the same thing. They don't do the same thing. Now, like I said, there are different sizes. Butterfly needles are typically smaller. We have small IVs too. So don't think that you can only get a small needle from a butterfly. It's not true. What else do I want to say about that? Oh, hard sticks. So yes, there are some people who are always a hard stick, but a lot of people are occasionally hard sticks. So yes, you may, have a fear of getting an IV because you know that the last time you had to get one, you had to get stuck multiple times, etc. Remember that when you are sick, a lot of times, especially if you're sick with diarrhea, vomiting, or not being able to eat, just no appetite type of a thing, you become dehydrated. The more hydrated you are, the easier it is for your veins to have an IV placed. Your veins will pop up better for us to feel them, and it makes it easier for us to do the IV. So keep in mind that when you're sick, yes, you may very well, become a hard stick because your body has no fluid on it for us to be able to get it. But just because you have been a hard stick before doesn't mean that you'll always be a hard stick. Also recognize that different people have different skills. The vast majority of us are decent at IVs, but we all have bad days. Sometimes we all have, times where there's just a person that you just can't stick. You can be getting IVs left and right all day long, and then you get to that one person, just doesn't work. It happens. I know for you, as the patient, it sucks to be stuck multiple times. If you want to set a limit on how many times you can be stuck, that is fine. If you don't get it after the first 2 times, go get somebody else, cool. There's no issues with that. But just realize that we don't want to stick you more than once either. It makes us feel bad because we often feel like we failed. Like this is something that, especially in the ER, and I'm bouncing back and forth between regular healthcare and being an ER nurse, but that's what I am. In the ER, we put IVs in all day long. That is like one of the most common things that we do on a daily basis. And so when we don't get a stick, it's like, dang, we do this all the time. Why couldn't I get this person? The very last thing that we want is to stick you more than once. So keep that in mind as well. Also keep in mind that putting IVs in is not, for lack of a better term, it's not literally, or it's not an exact science. Yes, we all have the same, vasculature for the most part. There are, everybody has a cephalic vein. Everybody has a brachial, vein, like all that stuff, all the technical stuff. Everybody has those same veins and arteries and blah, 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 blah. But the makeup of your body can shift things. And so even on, like I said, on a regular individual, like, some people have a vein right in the middle. You got to go right in the center and don't do it. But for some people, that vein doesn't work. So sometimes you might have to go off to the left or off to the right. Forearm veins are there. Hands work too. Like, there are so many different options, and there are going to be days where your sweet spot isn't sweet today. They always have to go right here, and then maybe it doesn't work, or maybe the person who is doing your IV can't see or feel that vein that you want them to go for. Recognize that we have to be confident in the vein that we pick. If you are not confident in it, it often makes it a lot more difficult to get it. So just trust your healthcare provider. Tell them you don't like to be stuck multiple times. Please be gentle. You have a 2-stick limit, a 3-stick limit, whatever the case is. But recognize that we don't want to stick you more than once, and we would like to get it the first time too. We're not trying to hurt you. There is also a machine called an ultrasound, the same ultrasound that you use to look at babies, that some people are trained to use for IVs. Not everybody is ultrasound guided IV trained. Some people will come in and say they always have to use an ultrasound on me. That's fine. Let us still look. A lot of facilities will have a policy where you have to at least try once or twice, depending on your facility, before you can get an ultrasound guided IV placed. So keep that in mind. If they're looking, you're like, I told you, you gotta get the ultrasound. You can't just stick me. Let them look. They just need confirmation so that when they go and get the person who is certified, or before they go and get the ultrasound machine, they know that there was no way they could just do a peripheral line, which is the one that is without the ultrasound, a peripheral IV line in you. Recognize that ultrasound IV lines go a whole lot deeper than a peripheral line, so they hurt more. So if you're asking for that straight off, yes, you might only have to get stuck once, but recognize that you're gonna go from a needle that's about this size to a needle that's like this size. It's gonna go deep in your arm and go to a vein that is most likely below musculature. So keep that in mind. All right, last question that I was given before we get to the big whammy was life after STDs. So our country, our world, is a very sexual world. People have various beliefs on sexual health, what is okay, what is not okay. We're not going to go into that. What we are going to go into is that you need to protect yourselves and you need to be smart. STDs are so easy to catch. And if you are going to be sleeping with multiple people, if you are going to be sleeping with one person who you don't know that well, you need to protect yourselves. Asking your partner to put on protection, or you wearing protection yourself, it is not saying that you don't trust them. It is covering your own behind in case something happens. You never want to be dealing with somebody that, you thought everything was going to be okay. And then you find out that, before they started messing with you, they were messing with somebody else. That person gave them something. They had no idea about it. And now you got it too. STDs are easily passed. Use protection. So that's first. Second, please get tested. There is nothing wrong with going to get tested, and the ER is not a place to go and get an STD test. Go to an urgent care, go to the health department, go to your primary care provider. Let them know that you want to get tested. You can get tested at your OBGYN appointments, ladies. Just make sure you guys are getting tested. It's better to get tested, find out you have something before you start exhibiting symptoms, than to only go get tested because you're exhibiting symptoms. You should be getting tested after any new sexual partner. If you're getting ready to start having sex with a new sexual partner, you should be getting tested before that. You need to know what you have and what you have the potential of passing. The person you are sleeping with needs to be able to know what you have and what you can be passing, and they need to be able to tell you what they have and what they can pass. We need to get away from the stigma that goes along with being tested for STDs. That is the only way we're going to get away from how many STDs are running rampant in this world right now. Now, with that being said, when you are diagnosed with an STD, there are treatments for the vast majority of STDs. You just typically need some antibiotics and to abstain from sex until you finish the course of antibiotics and you are STD free. But every now and then, you can get diagnosed with something that there technically is not a cure for, or that it has to run its course. There are viruses, like for instance the HPV virus, that stick around a little bit longer. Most people diagnosed with HPV are told that they will have it probably for at least 2 years before it will run its course and begin to leave their body. If you are diagnosed with herpes, that is something that typically does not go away. You will have that forever, but it doesn't mean that it's the end of your life. I have a friend who I'm really close with, who is in a new relationship, and I say new, but they've been together for a little bit now. But he was given an STD. My friend is the female in the relationship. He was given an STD by his ex, and he had no idea about it. She called him after him and my friend had been dating for several months. His ex-girlfriend called him after my friend had been dating for several months and let him know that she potentially gave him herpes. And so he went and got tested. Found out that he was positive for herpes, and he felt like his world shattered. I want to tell y'all that having herpes is not the end of the world. Herpes is a sexually transmitted disease that so many people in this world have. Every time you see somebody with a cold sore, that's herpes. Is it herpes type 1? Yes, most likely. But that is herpes. And the difference between herpes type 1 and herpes type 2 is just where you get your sores. There is no change in the disease process from type 1 to type 2. It's just whether it's oral herpes or if it's genital herpes. So you can have herpes type 1 as the cold sores around your lip. Herpes type 2 is down there. Now you can get herpes type 2 in the back of your throat doing some other stuff, but that is what it is. The how can I word this? You are most likely to transmit herpes to somebody else during an outbreak when you have sores that are open and there is something called a viral shedding, which is when the virus is being released through those sores. That is the most common way that you pass the virus on. You are more than likely not going to pass it on when you do not have any sores. Now, is it possible? Yes, but it is very, very, very unlikely. So with diseases like that will stay around for a long time, you just have to be careful. That's the end of it. Your life goes on. You can still have kids with herpes. There are medications that you can be placed on that prevent you from passing it on to your children, but herpes is not the end of the world. Most STDs and STIs are not the end of the world. And I used herpes just because that's something that just came up in my life, where a friend reached out to me who was, trying to figure out what to do and how they were going to move forward in their relationship. But there are others. And like I said, you need to talk to your doctor if you have been diagnosed with anything and find out what their treatment plan is. They will let you know what your life outlook is going to look like. They will let you know what has to change, what doesn't have to change. Take, for instance, HIV. HIV and AIDS, first off, they are not the same thing. HIV is the virus that leads to AIDS. When you have been diagnosed with HIV, you are put on a regimen of medications to try and limit what is called your viral load. You will hear people ask what their CD4 count is to somebody who has HIV. CD4 count is basically a number that quantifies how likely you are to transmit the virus. It is possible to be diagnosed with HIV and get what is called an undetectable viral load. When your viral load is undetectable, you are virtually never going to pass this virus to anybody else. That does not mean start being crazy. Doesn't mean go out and have unprotected sex and do a bunch of stuff that you shouldn't be doing. But it is the ideal place to be when diagnosed with HIV. And you will always have HIV even if you have an undetectable viral load. But that is where you want to be. That is the goal. So like I said, there are treatment plans no matter what you are diagnosed with. Talk to your doctor, follow the treatment plans you were given, take the medications that they tell you to take in the way that they tell you to take them. And I say that because people often, and I don't think it's always intentional, but sometimes people don't listen to the recommendations of their doctor. Your doctor can tell you to take this, morning and night, and you're taking it twice in the morning because you don't feel like taking it at night, or whatever the case is. Medications have half-lives, and when you are told how often to take something, it is so that the medication is consistently in your system, consistently doing the work that we need it to do to make you better. When you start changing up the way that you're taking a medication, you're changing how effective that medication is. So then when you're not taking it right and you don't heal, you can't be mad because you were told how to do it. Now, if you were taking it wrong because you have a question on it or you didn't understand your instructions, that's why I say ask the question. Make sure you are fully understanding any instructions your doctor gives you, because that is going to give you the best outcomes. So, life after STDs, it's 100% something that is doable. Just talk to your doctor, follow their recommendations, and live your life. Alrighty, people. Time for the big whammy. COVID-19, aka the coronavirus. The coronavirus has officially been deemed a pandemic. There are schools closing for 2 to 3 weeks. Some, attractions, some of the world's attractions, Disney World, Disneyland, things are being closed indefinitely for 8 weeks, 5 weeks, whatever. All across the country, we are seeing things closing. And a lot of you are wondering why. I have seen people talking about things like, why are churches closing? We have faith that God can do all things and things of that nature. Let me say this. Even if you don't know anything about how diseases are spread, you should be following the recommendations of the people who have studied this stuff. So I'm going to start with saying COVID-19 is not a game. I know that it's not something any of us could have fathomed seeing in this day and age, but it's here and it's happening. The reason that so many governments are shutting down schools and restaurants and bars and all that stuff is because you contain a virus by containing the virus. When you allow people to be in large groups together, that is how viruses spread. One person in a large group of people can have COVID-19. They can infect several, if not all, of those people that were at whatever that specific gathering was. Now, each of those people leave that gathering and they go home and they infect everybody at their home. Now, all the people at that home leave there and go to work and go to school, and then they infect people at work and school. This is how viruses spread. You hear people talking about flattening the curve. That is what they're referencing. Right now, with us not having this thing contained, the curve is looking very much like a bell curve, and it's a tall one. There's exponential growth in the number of confirmed cases, and it's going to fly up but it's going to fly back down because everybody's going to be sick at the same time. But the problem with everybody being sick at the same time is that our healthcare industry, it can't handle that. When you hear people say they want to flatten the curve, you want to slow down the rate of exposure. And you do that by stopping people from being together in large groups. When you slow that down, you do still get an increase in cases, but it is a slower increase. As quickly as people are getting sick, you are ruling out or getting other people that are sick out of the hospitals, and that allows everybody to get adequate treatment, that allows less people to have, severe reactions, that protects our elderly, that protects our kids. That's why governments are shutting things down. And I know that it seems like a lot, but this is what I'm going to tell you about to help you understand that it's not. So in 1918, there was something called the Spanish flu, or people called it another name. What was it called? I forget. But anyway, so the Spanish flu, it was a type of influenza that wrecked Philadelphia. It wrecked Philadelphia because as people and places were beginning to shut things down, Philadelphia decided to have a big parade. They had a parade. Let's see, the date of the parade was September 28th, 1918. There were about 10,000 people that came out to a parade called the Liberty Loan Parade. It was a patriotic spectacle designed to boost public financing for World War I. And I'm going to put a link to this article that I'm reading you in the description. So, the pandemic of the influenza had already reached Philly in the beginning of September. A Navy ship came from Boston and arrived at the Navy Yard, and 525 people had come down with the illness before the parade. But they decided that the parade must go on. There was an article, I believe this was an article in the Inquirer back at that time in 1918, and it was stated, what are they trying to do? Scare everybody to death? Yes, this was a newspaper. It was written in an editorial in the newspaper. The quote reads, "The fear of influenza is creating a panic, an unreasonable panic that will be promoted, we suspect, by the drastic commands of the authorities. Steer clear of it, therefore, and talk of cheerful things, of health, for instance, instead of disease." I am a firm believer in the fact that history always repeats itself. This very much sounds like what we're dealing with now. People are wondering why everything's closing, why everybody's panicking. But before this parade happened, there were multiple letters from physicians not asking but demanding that they cancel the parade. The incubation period for the Spanish flu was 24 to 72 hours. That's 2 to 3 days. Right on track, the disease exploded in the city after the parade. Just 5 days after the parade, hundreds of new cases and dozens of deaths were being recorded each day, and those numbers would skyrocket in the weeks to follow. So city officials ordered all schools, theaters, and churches closed indefinitely. They also closed the bars, the pool rooms, the dance halls. Hotels, barbershops, restaurants, and lunch counters were left open, but their employees were required to cease work upon the first sign of flu. These are all things that sound familiar. However, 10,000 people were at that event with an incubation period of 2 to 3 days, and within 5 days, the vast majority of those people were sick, and anybody that they came in contact with ended up getting sick. COVID-19 has an incubation period of 2 to 14 days. That is 2 weeks. You can come into contact with this virus and not have any symptoms until 2 weeks after you came in contact with it. The reason things are being shut down is because you can have no symptoms during that 2-week period and go on communicating with people and going out to different functions, and you are infecting everybody you come in contact with and you have no idea. So then after your 2 weeks are up and you start feeling sick, and then you want to go get tested for COVID-19, and then you find out you're positive, if you're young and you're healthy, you're probably going to recover. It's going to be a terrible couple days for you. It's going to be like having the flu, and you're going to be sick and you're not going to like it. You're going to, have a sore throat and have a cough and, just feel generally cruddy. And then you're going to be okay. But if during that 2-week incubation period where you were passing this on to other people, you came into contact with somebody who already has respiratory illness, somebody who is already immunocompromised, say they may have cancer, or, any kind of a disease. They might have just got a transplant, so they would generally be healthy, but they had to deplete their immune system in order for their body not to reject the transplant. You infected those people. Those are the people that are going to be severely ill. Those are the people that are going to need our ICU beds, that are going to need to be put on vents in order to make it. And while you're going to be fine, the people you came in contact with are not going to be fine. So that's why things are closing. I know it seems like these are drastic measures, but they're not. If you don't have to go out of your house, don't. If you need groceries, do a grocery delivery service, order stuff online, do carside pickup at Walmart or whatever, but try to avoid places that are going to have large crowds. It just makes the most sense. That is the only way that we are going to slow this virus. At this current moment, there are, let me refresh this page and make sure there haven't been any more since I last looked, and there are 167,457 confirmed cases all across the globe. In the United States, there are currently 3,499 cases. The thing that also makes these measures that we are taking not drastic is that they're still studying this coronavirus. This is a new coronavirus. You hear people call it a novel coronavirus. So let me back up a little bit. Yes, when you look on the back of your Clorox wipes and your Lysol wipes, it does say that it kills human coronavirus. But that's not killing this thing. This COVID-19 is a new strand of the coronavirus. It is something that we've never seen before. We are not 100% sure how it is passed. We don't have any vaccination for it. It's something that we are still studying as people are getting sick. Like as this condition, as people's conditionings are worsening, and as more people are getting this thing, we are studying it. It's happening simultaneously. We're gathering information as people are getting sick. That being said, we have to take an abundance of caution to try to keep this thing contained. We don't know for sure if it is just an airborne disease, or if it's just droplet, or if it's airborne and droplet, or if it's contact. These are like ways that diseases are transmitted. We're not sure. Healthcare institutions are severely understocked with masks because everybody wants one. Buildings are requiring screenings before you're let in, and you might think this is drastic, but it's not. It's trying to protect you. And I find that the vast majority of people in the world have a God complex. We often think oh, well, that'll never happen to me. Nothing like that'll ever happen to me. I'm going to go on about my business. I'm going to do what I want to do, and everything is going to be fine. But what if it's not? What if this is the one time that something goes wrong for you? You just have to be prepared, and you have to be smart. For those who are religious, like I said, I saw people talking about churches shouldn't close because we believe in God. Yes, we do believe in God. Yes, God can do all things. However, God also gave us common sense. God gave us the doctors who have studied diseases, who have studied pandemics, who have studied epidemiology and, infectious disease. God gave us those people too. And we should be using those resources to our benefit. We need to be listening to the people who have been studying this stuff for years and years to come. I saw something earlier that said 1 in 5 people are going to be infected with the coronavirus if we can't slow it down. Everybody in America knows more than 5 people. That means that we are all guaranteed to know somebody who is infected, which means that we are all at risk of being infected and of spreading infection unless we start following directions. So I know it is hard. I know you want to go about life as usual, but we need to take this seriously, because if we don't, it's gonna get a whole lot worse before it gets better. Honestly, even if we do take it really seriously on an individual level, it's still gonna get worse before it gets better, because the majority of us are not gonna take it seriously. Schools are closing, stores are closing, and all that stuff is happening, but people are still gonna leave their house and they're still gonna do what they wanna do. But you can only protect yourself, and you protect yourself by you staying home. So if you don't have to be out, stay home. And then you can see the virus be infecting those people who didn't listen, but you'll know that you're okay. I think that's the end of my spiel on the coronavirus. Just be smart. Don't go anywhere that you don't have to go. Protect yourselves. Please wash your hands. Yes, hand sanitizer is important, but get to a sink and use some soap and water if you can. Hand sanitizer does not replace soap and water. It is to be used in conjunction with soap and water. So yes, have your hand sanitizer so that you can clean your hands when you're out and about. But if you can, go into a bathroom and wash your hands. Don't touch your face. Keep your fingers out your mouth and your nose. And just be smart. That's the end of this video, y'all. If y'all have any questions, if there's anything else you'd like me to answer, please leave me comments. I would love to answer as many questions as I have. I'm really excited about putting on my nurse hat for my first video. Like I said, if there's anything that I wasn't clear about, please ask me questions. Make sure you like, comment, subscribe, and please share this video, because I really do want people to feel like they have a resource, that they have somewhere that they can ask questions and have them answered by a medical professional. If you don't want to post your question publicly, please DM me on IG or DM me on Snapchat or whatever. Just reach out to me. Let me know what your questions are, and I'll be happy to answer them. If you don't want me to answer them on video, I'm totally okay with that too. I can, do some research on the question or give you my opinion on your question right back to back in a message. I do not have any issues interacting with my Danny loves, because I love y'all and I appreciate y'all for watching my videos. So yeah, I hope y'all have a good week, and yeah, that's it. I'll see y'all later, Danny loves. Thanks for watching.